All right, so in trying to address issues that have to do with women having weak bones, all right, most of the times when they are after menstruation, so after menstruation when estrogen is no longer being produced, so most women come down with weak bones. So it's not only women though, right? Anybody could have weak bones, right? And you want to actually dictate or diagnose it. So one of the ways of diagnosing weak bones is the DEXA. That's a dual energy X-ray absorptiometry. Okay, so for this imaging modality, of course, it's something that I put you under here. I'm looking at the image on the laptop. Now it will help me know if your bones are thick or if they are thin. You understand? So it can be abbreviated as well, DEXA or just DXA. So it's a specialized imaging technique. It's used to measure what? Bone mineral density. So you want to actually see how thick the bone is, right? So it's a good standard for diagnosing conditions like what? Osteoporosis. The person has weak bones, So how it works, it uses two X-ray beams at different energy levels. You aim it at the bones. Mostly the bones they check out for is the bone of the spine or the bone of the hip. You can see that this is what? The lumbar spine. You can see that this is a hip bone. You understand? So the difference in absorption between the beams helps to now isolate bone density from soft tissues. So the scan is quick, non-invasive, there's low radiation. Alright, so what it measures the bone density to see if you are losing bone or if the bone is thinning up. Alright, then T-score, they can now compare the result they got with a healthy young adult of your sex. Then Z-score, they can now compare how your bone is appearing. Is it thin or stuff? They compare it to somebody of your age. Do you understand? So all of that are calculations that they do to now arrive at a diagnosis if you have an issue. So it's commonly used to diagnose what? Issues like osteoporosis, where you are losing calcium from your bone. Okay, osteopenia, which is like you are losing calcium from your bone but it hasn't gotten to osteoporosis level. Do you understand? So osteopenia is like a junior sister to osteoporosis. You can monitor bone loss over time. If they are doing it repeatedly, it will help them to know if it is over time that you're having the issue. You can evaluate if you are responding better to a treatment. That's if you have already been diagnosed of this issue and they have started offering you medication. You can assess if there is a risk of you having a fracture anytime from now. So most people who actually are affected by bone loss, so women over 65, men over 70, all right, then some people, maybe people from their family have generally been having these issues, so you have it. All right, then other people that some drugs you take, some alcohols you abuse, and all of that could actually predispose you to having these issues.